Hi, my name is Travis Porter, and I work at Diversis Health. I'm a licensed psychologist and licensed addiction counselor. To answer that, I'd like to turn to the American Society of Addiction Medicine. They define addiction as a treatable, chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. People with addiction use substances or engage in behaviors that become compulsive and often continue despite harmful consequences. Prevention efforts and treatment approaches for addiction are generally as successful as those for other chronic diseases. There are 3 signs that we look for, among others. First, a persistent use despite negative consequences. The second, an inability to control use. And third, craving. No, addiction used to be thought of as a choice, but now we know because of brain imaging that craving can be present long after substance use has stopped. Craving defeats the choice argument because while a person can choose to stop using, they can't choose to not crave. In short, addiction is a disease of choice because it affects the parts of the brain that we need to make wise decisions. There are 3 resources I like to direct people toward. The first is The Anonymous People, a documentary about the 23.5 million Americans living in long-term recovery. The second is Pleasure Unwoven, featuring a physician in recovery, Kevin McCauley. And third is the HBO series on addiction. These resources can be found online.